Good evening. Thanks for joining us. We begin tonight with the dire demand for staff to keep our healthcare system going. From hospitals to care homes, facilities are increasingly turning to private agencies to find nurses. It's extremely expensive and can lead to problems for our frail elders. CTV's Penny Daflos now with a closer look at the agency staffing costing taxpayers millions.
Seniors in long-term care need special attention from qualified nurses and aides. A growing number of those staff are contractors there for one shift at a time amid a severe staffing shortage.
Nursing agencies are taking advantage of this situation by hiring away registered nurses, licensed practical nurses, and in fact care aides, and then offering them back to care homes at a vastly inflated price.
Not only are frail elders often confused by a constant parade of new faces, care sometimes suffers.
We're hearing of situations where we have medication errors because the person coming in from the agency may not be familiar with the care plan.
Operators say agency staff are increasing in all areas of BC, with care homes in smaller communities seeing 3/4 of staff in rare cases all they're on contract.
We ignored the workforce for 15 years, and now we wonder that they have a better opportunity. They're going there.
They used to be called traveling staff, temping in smaller communities to cover for illnesses or vacation. Now, unionized workers are switching to those jobs which pay twice as much without mandated overtime.
Really vicious cycle of more people leaving, workload gets more intense in those that are working in the public system.
It had been tried many places. It always proved to be a disaster.
Government has consistently fought disclosure of how much it's paying for-profit companies to staff nurses and technicians at critical infrastructure like hospitals and care homes.
Where are your tax dollars going? Is it to these private industries and making them richer, or is it investing into the workforce that is committed to British Columbia?
CTV News had to make a series of repeated requests over months to find that since the pandemic, BC has seen a 7-fold increase in payments to for-profit agencies, upwards of $146 million.
We've taken a series of specific actions: retention, supporting permanent work, the recruitment efforts we're making, and the work we've done, which is, I think, the most historic union agreement with the BCNU in the history of BC, all of which is to support permanent nurses.
Penny, I think a lot of taxpayers are pretty appalled that so much money is going to these private agencies. So do we know if government spending on these for-profit companies has gone up or down this year?
It's really hard to say. Some of these millions of dollars was spent on contact tracing and mass vaccinations for the pandemic. So we haven't had those for a while, but it's really offset by a growing reliance on agency staff to essentially prop up our hospitals and care homes and keep them running. I do likely see some freedom of information battles in the future to see if agency spending has gone up or down, mi-jung.
I know you're trying to get those numbers, right?
I am.
Okay, thanks.